The doctor's examining the loops of bowel, trying to find the appendix, and she's found it, and so she'll remove that. We keep that as basically as a way of helping us identify people. If they have their appendix in place, it's an identifying feature. Now the ribs are being cut so that the chest cavity can be exposed. Now he's also cutting the next portion of the diaphragm and reflecting back the chest plate in order to expose the heart and lungs. And now you see the heart and lungs in place. What he's doing now is cutting the pulmonary artery and checking to make sure there are no blood clots in there. A pulmonary embolus, which is when somebody throws a clot to the lung, is when a large clot is formed somewhere else in the body and then travels to the lung. What he pulled out was not a clot that formed while the person was alive. That was a post-mortem blood clot. Now the heart has been removed. The next step will be to remove the lungs. He's taking the right lung out first. He's cut the bronchus, the main airway to the lung, and notice that there was some mucoid material in that bronchus. He's now removing the pericardial sac and reflecting the diaphragm in order to free up the liver for removal. Pardon me, spleen is coming out now. That sits in the left upper quadrant of the abdomen. That's about a normal shape and size. What he's doing now is he's putting a clamp on the proximal end of the small intestine, the duodenum, and then he'll free up all of the intestine so that it can be removed in a block. And there we go. That's an adrenal gland, which he's dissected off the top of one of the kidneys. Is that the left, Dave?
Right.
Right,
yeah.
okay.
Right.
Now he's incising the renal capsule, which is a thin membrane that surrounds, here, Dave, right there.
Yes.
That surrounds the kidneys, and he'll strip that back to expose the kidney itself and then remove the kidney. He's going to free up all of the tissues through to the base of the tongue. And then dissect down along either side so that the neck organs can be removed along with the tongue. Now that he's down in the upper chest, he can transect them because that leaves enough room for them to infuse embalming fluid through those vessels down low. Okay, he's now reflecting the scalp. The front has been done. Now he'll reflect the posterior portion. Now that all of the incisions have been made, he'll use the key in order to free it up and peel it off from the dura. And as you can see, now the brain has been exposed. First thing he'll do is reach down in and cut the optic nerves. They're the first thing that will holding the brain in place. Once those have been cut, he'll cut some of the other nerves, and then he'll need to make an incision through the tentorium, which is a tough membrane that holds the cerebellum in the posterior fossa of the skull. Once that's done, he can put his knife down into the foramen magnum and transect the spinal column and essentially deliver the brain. The skull on the inside is lined by a tough membrane, the dura mater. In order for us to be able to visualize if there's any fractures, that membrane needs to be peeled away from the underlying bone. So that's what the assistant is doing now. Dr. Fricke's now examining the heart. The first thing she'll be doing is looking at the coronary arteries to make sure that they're intact and that there's no signs of thrombosis or atherosclerosis. The artery she's dissecting right now is called the left anterior descending artery. This is the vessel that supplies the anterior portion of the left side of the heart, or the main pumping chamber of the heart. Representative samples of the various tissues that are examined will be saved in formaldehyde, and so that's what you're seeing her do right now. The outflow tract to the pulmonary artery is normal, and the 3 leaflets of the pulmonary valve are intact and normal. This is the aorta she's opened, the aortic valve, and you can see the 2 coronary ostia where the coronary arteries come off from the aorta, just above the valve cusps. This is the right lung. Yeah, this is the right lung. You can tell that it's the right lung because it has 3 lobes, 1, 2, and 3. The left lung normally will have 2. Sometimes you can find multiple lobes in both lungs. Sometimes up to 5 separate lobes may be seen. Dr. Fricke's now opening the main bronchus of the right lung and following it out through its primary and secondary divisions. Again, the purpose of this is to see if there's any evidence of disease or other abnormalities, such as obstruction by foreign bodies. She's examining the liver. This is the inferior or under surface of the liver. The gallbladder has already been opened, and that's what she's looking at there. The top surface of the liver, seen here with the larger portion being the right lobe, the smaller portion the left lobe. The color and appearance of the liver are normal. It's a little darker than expected, which is probably due again to congestion or the backup of blood in the organ. These are the kidneys. Remember that the left kidney was the one which had all of the scarring and is markedly shrunken in... Was it right? Pardon me. It was markedly shrunken in comparison to the right side. Oh, that's weird. Looks like a brain. What you're seeing is that there's marked thinning of the cortical tissues and portions of the medulla.
Really very different.
See how much more full and thick the tissues are in the uninvolved kidney. This is the spleen, outer surface, and then the inner surface with hilum, which is where the blood vessels enter the spleen. The is intact, thin, essentially normal. The parenchyma, or internal part of the organ, appears a little congested or filled with blood, but otherwise normal. This is the organ block containing the uterus, fallopian tubes, and ovaries, along with the vaginal stump, and the urinary bladder. The bladder is anterior to the uterus. This is opened through the urethra or urethral meatus. Oh, it doesn't look that bad for somebody. Dr. Fricke is now dissecting off the bladder and opening the vagina so that she can see the cervix. This is a cervix that has a slit-like opening, which would indicate that this person has probably had at least one child. The uterus is normal shape and size. And no evidence of tumors in the muscular wall of the uterus. The endometrial cavity appears a little hemorrhagic, could be an early menstrual phase.
So she's just real congested.
Yeah.
Oh, she has a lot
Oh,
of
a little leiomyoma. This is a benign muscle tumor of the uterine wall. The fallopian tubes are intact, and the ovaries appear, again, normal shape and size. There may be some small cysts.
Yeah, she's still making, she's still ovulating.
Yeah, you can see a corpus luteum, which is that yellow and red structure.
These are just ovaries.
Now we're doing the neck block with the attached tongue. This is the epiglottis here. The vocal cords can be seen down in that opening.
This is the anesthesiologist and paramedics view. This is what they see.
This is what they see when they're trying to intubate somebody. Okay. First, you'll open the esophagus. And you can just see a normal-looking mucosa, no foreign bodies. Next, she will open the larynx and trachea. And again, a very normal-looking appearance. And those are the vocal cords there and there. Finally, she'll open the aorta. And you can see the openings for the branches of the costal arteries, the ones that run into your rib, coming off of the thoracic aorta. Next, you'll dissect down to expose the thyroid gland, which essentially sits like a butterfly wrapped with its wings wrapped around either side of the trachea. Thyroid gland. Again, looking like it has normal shape, color, and consistency. These are the adrenal glands that sit on top of the kidneys. As you can see, they have two layers. One is that outer sort of yellow layer. The inner is a darker red-brown. The outer layer is where you produce various hormones such as the steroid hormones, other things that control fluid balance in the body, things like that. The inner layer, the red one, is the adrenal medulla, and that's where you produce epinephrine or adrenaline that gives you that surge in a fight or flight situation. Finally, the brain. Nice symmetry, no evidence of some process involving one side of the brain over the other. The inferior surface, the top of, and now it shows the various cranial nerves. The olfactory nerves are the two long ones across the front of the brain. That's what she's touching now is where the optic chiasm is, where the optic nerves cross. Various cranial nerves extend off to either side of the brainstem. That's like the trigeminal.
This is the internal carotid.
The vessels are intact, do not have atherosclerosis. First thing she'll do is remove the cerebellum. Those two black stripes, yeah, the same thing, yeah. Those two black stripes are the substantia nigra.
In fact, this is the guy who had the fetal brain transplant. This was the cells they were replacing. I wonder how he's doing. You know, he had a stroke.
See?
So they think he did.
Wow. She's now dissecting off the brainstem from the cerebellum, cutting the cerebellar peduncles. Waiting for the guest of honor. Huh? Waiting for the guest of honor. Now dissecting through this brainstem. Again, making sure that there's no signs of any abnormality.
So this is the midbrain that had the
Substantia.
The substantia nigra. Then you get into the pons, which has lots and lots of crossing fibers. And then the medulla, where the fibers straighten out and are running up and down, getting ready for the spinal cord.
What you're seeing is the white or light-colored portions of the brain are essentially wiring, and then the grayer, darker parts are where cell bodies reside.
I think this is the cerebellum. This central lobe right here is the vermis, the part that goes bad in malnourished alcoholic. This is the dentate nucleus, which is one of the places we look for signs of interruption of oxygen supply. It's very sensitive. The coordination center of the cerebellum. I don't think the lady was.
I sure hope you find some amitriptyline. Yeah. These are the various lobes of the brain, the frontal lobes. These are the temporal lobes. This would be parietal and occipital towards the back.
Mammillary bodies?
Now, those two small dots are called the mammillary bodies. Now what she'll do is just serially section through the brain. That division between white and gray is more apparent here in the cerebral cortex. You can see fluid leaking from the ventricular system. The white band crossing from the right and left sides is the corpus callosum. Essentially, that's how the two halves of your brain communicate with each other.